of Health Sciences. So today, I want you guys to learn something new from me because I will be doing a return demonstration about the proper assessment of the head, eyes, ears, nose, mouth, and neck. But first, let us talk about what is head, eyes, ears, nose, mouth, and neck assessment. The assessment of head and neck requires visual inspection, obtaining measurements, palpation, use of an ophthalmoscope, brief auscultation, and in rare cases, trans illumination. Viewing the head from above may facilitate assessment of skull shape. The examiner can elevate the tip of the nose slightly to view the nasal septum, the floor of the nose, and the turbinate. Examination of the eyes and mouth requires the patient's cooperation, and the examiners needs to be alert for opportune times. And now, let us talk about the purpose of head, eyes, ears, nose, mouth, and neck assessment. First, careful examination of the head and neck is important because abnormalities presenting at birth in these regions are often indicative of other anomalies or a specific syndrome. And lastly, this assessment will help you pinpoint solutions for vision issues, hearing loss and allergies, and identify lumps before they become life-threatening.
At first, you must perform a hand hygiene.
Good day, sir. This is Aliyah, your nurse for today, and I am here to perform an assessment. But first, is this patient Joshua?
Yes.
Which I will examine the head, eyes, ears, nose, mouth, and neck.
And yes, don't forget to close the door as well as the curtains for patient's privacy.
And now, sir, let me explain the purpose of health examination. So, the purpose of a regular health examination is to assess your overall health, screen for risk factors and disease, and offer preventive counseling. So, for now, I will be conducting an assessment first to your head, then followed by your eyes, ears, nose, mouth, and also to your neck. Do you have any questions, sir?
Not so far.
Okay, sir, and then if you have, please don't hesitate to ask me.
Okay.
At this point, sir, I will be going to inspect your head and face for color, symmetry, lesion, and distribution of facial hair. As I assess my patient, for the head, it is in normal condition and without significant abnormalities. And for the face, the eyes, ears, nose, and mouth are symmetrically placed. And the nasolabial folds and palebral fissures are equal. No abnormal movements noted, held still and upright, and no lesion noted. And for your skin coloration, sir, you have an even colored skin tones without unusual or prominent discoloration. For now, sir, I will be going to inspect your eyelids, eyelashes, eyebrows, eyeball, and followed by sclera, conjunctiva, and cornea. Based on my observation, sir, the eyebrows are in symmetric shape and the eyelashes are in similar quantity and distribution. So in here, sir, can you please close your eyes and then open it? So in here, the distances between the palpebral fissures are equal, and the eyelids are symmetrically cover the eyeballs when my patient closed his eyes. And now, sir, I will be going to examine your pupils in order for me to check its size and shape. And sir, allow me to use this pen light to shine each of your pupil. Based on my observation, sir, the pupils are round and equal in size. And for your pupils' reaction to light, the direct reaction is faster and greater than the conceptual reaction. And sir, it is basically normal. And now, let us proceed to test the pupillary accommodation and convergence. Sir, can you please stare off on a distant object? And I will bring my pen light closer to your nose. Sir, based on my observation, the pupils constrict and the eyes converge while bringing my pen light closer to your nose, and it's a normal finding. And now, sir, let me check the red reflex in your eyes using this ophthalmoscope. Based on my observation, sir, a red reflex is emanated from both of your eyes, and they are both symmetric in character, and it is considered normal. So in here, I have a Snellen chart to test my patient visual acuity. Can you cover your left eye, please, using this small card? And then read left to right, from top of the chart down to the smallest line of the letter that you can see.
E, F, P, T, O, Z, L, P, T, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, P, E, C.
Next, can you cover your right eye, please? Then read it again in the same manner.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Based on my observation, sir, you can clearly see at 20 feet and what should normally be seen at a distance. So meaning, sir, your vision is 20/20 and it's a normal vision acuity. So in here, I will ask my patient to just focus on my pen light, and I will be going to examine him through the 6th cardinal position of gaze. Based on my observation, sir, you're able to follow as I move my pen. Specifically, you possess a smooth movement as you track my pen, and that is normal. So in here, I will be going to inspect my patient's external ear bilaterally. As I assess my patient, the external auditory matrix has no drainage. His ear is shaped like letter C, formed by helix and earlobe. And for the size, it is symmetrical. And the color of the ears is matched to the surrounding area of the face, with no nodules, swelling, lesions, and redness. For now, we will be heading to an otoscopic examination. And sir, just tell me if any discomfort is experienced, and do not move your head or pull away, okay? Sir, I will pull your auricle up, then back. Based on my observation, sir, the external auditory canal is open without tenderness, lesions, growths, inflammation, and discharge or foreign substances. And sir, there is a little dry earwax present in your external auditory canal, and it is normal. And now, I will be going to use whisper voice to test my patient's hearing. And I will stand for about 1 foot away from you and out of your line of vision. And sir, I will first test your right ear. Can you please cover your left ear using your index finger? And then, when I whisper something, sir, repeat after me.
I am handsome.
Next, sir, I will be going to test your left ear. And sir, can you please cover your right ear using your index finger? And when I whisper something, repeat after me. Just kidding.
Just kidding.
Okay, sir, great. We are all done. And based on my observation, your hearing is excellent because you were able to repeat all the words I whispered earlier. And next, I will be going to use a tuning fork to perform Weber's test. So in here, I will going to strike the tuning fork lightly on my hand and then place it on the top of my patient's head. Sir, can you please tell me where can you hear the sound?
Equally in my both ears.
Okay, sir, that would be great. Next, I will be going to perform a Rene test or Rene test. So in here, after striking the tuning fork, I will be going to place the tuning fork or the vibrating tuning fork on my patient's masseter bone. And when my patient said that the tone stops, I will move the still vibrating tuning fork to the ears opening without touching my patient's ears and ask him when the tone stops.
The tone stops. The tone stops.
Sir, based on my observation, the air conduction is better than the bone conduction and it's a positive Rene test result. So in here, I put on gloves and I will be going to palpate and inspect my patient's external nose, and I will be going to palpate it for tenderness, swelling, and stability. As I assess my patient, the nose is straight in proportion to the other facial structure. It is in midline without deformities, and the narrows are equal in size. The skin is intact, and there is no drainage or inflammation present. And also, there is smoothness and stability to the underlying soft tissue and cartilage. So for now, I will be going to palpate and lightly percuss my patient over the frontal and maxillary sinuses. And now, I will begin by pressing my thumb over the frontal sinuses of my patient below the superior orbital ridge. Do you feel any pain, sir?
None.
And then, I will be going to palpate the maxillary sinuses of my patient below the zygomatic arches of the cheekbones. Do you feel any pain, sir?
None.
As I assess my patient frontal and maxillary sinuses, there is no tenderness and pain upon palpation. Next, I will be going to ask my patient to occlude one nostril externally and with the finger while my patient breathes through the other. Sir, please occlude one of your nostril and breathe normally. The other one, sir. As I assess my patient, who was able to breathe in both nostrils, and no black and no unwanted sound is present. Next, I will be going to inspect my patient's internal nostrils using this otoscope with a nasal speculum attachment. Based on my observation, sir, the mucosa is dark pink in color and it is smooth without swelling, discharge, bleeding, or foreign bodies, and the septum is in the midline, intact and straight. Next, I will be going to palpate my patient's temporomandibular joint by placing my index finger in the front of each ear, okay, as I ask my patient to open and close his mouth. Open your mouth, sir. Closed. Open your mouth again, sir. Open it widely. And then closed, sir. Do you feel any pain, sir?
No.
Okay, sir. As I assess my patient, there is no pain and limitation of movement to his temporomandibular joint. And now, I will be going to inspect my patient's lips, oral mucosa, hard and soft palates, gingiva, teeth, and salivary gland opening. Open your mouth, sir. As I assess my patient, the lips are symmetric, smooth, pink, moist, and without lesion. And now, sir, can you clench your teeth? And then smile for me. Okay, in here, the teeth is white in color and with smooth edges and free of debris. Next, I will be going to inspect my patient tongue and uvula, and as well as palpate my patient tongue for muscle tone and tenderness. And then, sir, can you stick out your tongue for me and then say ah?
Ah.
Okay, sir. As I assess my patient, the tongue is pink and moist with papilla on the dorsal surface, and the ventral surface is smooth and pink in color, and also the tissue is smooth, pink in color, and free of lesion, and also the soft palate and uvula is smooth and pink in color and upwardly movable. Next, I will be going to palpate my patient from the forehead down to the patient posterior triangle neck for the posterior cervical lymph node, and using my finger pads in a slow and circular motion. Do you feel any pain, sir?
None.
Do you feel any pain, sir?
None.
As I assess my patient, there is no pain, no bumps or submerged part as I palpate the area. Next, I will be going to inspect and palpate the in front of and behind the ears, under the chin, and in the anterior triangle for the anterior cervical lymph nodes. Do you feel any pain, sir?
None.
How about here, sir? Do you feel any pain?
None.
As I assess my patient, there is no pain, no bumps or submerged part as I palpate the area. Next, I will be going to inspect and palpate the left and then to the right carotid artery of my patient. And then I will use the ball of my stethoscope to auscultate it. Do you feel anything, sir?
None.
How about in here, sir?
None.
As I assess my patient, the pulse is in normal state, no pain indication from my patient as I auscultate, and no presence of bumps or submerged area. For now, I will be going to inspect and palpate for the trachea. Do you feel any pain, sir?
None.
As I assess my patient, the C rings or the circuit cartilage can be felt, and the trachea is in midline, and the distance between the sternocleidomastoid muscle on each side is equal, and the hyoid bone and the tracheal cartilage move when the patient swallows. Next, I will be going to palpate my patient's thyroid gland. Now, sir, I will give you a cup of water, and as you take a sip of it, I will inspect your thyroid area. Would that be okay?
Okay.
As I assess my patient swallows, it moves superiorly because the thyroid tissue is attached to the trachea. Another way to palpate the thyroid gland is from behind the patient. Sir, can you please sit up straight? Then lower your chin. Then look at to your left side. Then to your right side. Okay, sir? As I assess my patient, normally you will not feel the thyroid gland during the palpation, but I was able to feel the fullness of the thyroid as it moves up upon swallowing. And now, I will be going to inspect and palpate the supraclavicular area of my patient. Do you feel any pain, sir?
None.
As I assess my patient, there is no pain, no any bumps or submerged part, and also, I can feel the gland in its correct area behind the bone. Next, I will be going to inspect the ability of my patient to move his neck. Sir, can you slowly move and touch your chin to the chest? And then turn your head to the right, and then to the left, and then touch the left ear to the left shoulder, and then your right ear to your right shoulder. Do you feel any pain, sir?
None.
As I assess my patient, there is no pain and no limitation in his movement.
After doing the procedure, don't forget to perform a hand hygiene. And then, initiate appropriate referral to other healthcare practitioner for further evaluation as indicated.
And that ends my written demonstration about the proper assessment of the head, eyes, ears, nose, mouth, and neck. I hope you learned something new from me today. I hope to see you next time in my another written demonstration. Once again, this is Aliyah Piayeras, a nursing student from LPU St. Cabrini School of Health Sciences. Thank you for watching!